without doctor's prescription. Call on doctor's attention if you need solution. Too much is given, much is expected.
All right, thank you for joining us on your favorite program, Earth Corner. Indeed, to whom much is given, much is expected. And we all know that our health should be the first thing that we need to think about or work about. There is a general saying that health is wealth. If you are not healthy, no matter how rich you are, no matter what you acquire, it is just mere playing. But if you have a good health, definitely you will live a better life. This is your favorite program, Health Corner, on Esteem Radio Vision, located at Obokun Avenue, Ilesha, Osun State. This program is proudly sponsored by Eni Aponle Foundation, just for us to have a sound health. That is why we have this program. And today, what we are going to talk about is something that many Nigerians, or let me say many of us, we just look at it as a common sickness, that oh, this is common, and this is it doesn't mean anything if I'm having it. And what is that thing that we are going to discuss? I will let you know. My name is Adenipekun Afolabi, and many thanks to the executive producer in person of Deacon Michael Adeboye Ashaolu. And today, I'm not the one who will do the justice to the topic that we want to treat today. I have a guest, a professional nurse, who is going to give us more information and what we need to know about what we are about to discuss today. And what is that thing? Before then, I need to introduce to you my guest. And you know, looking at the situation in the whole world, or let me say in Nigeria, the statistics shows that Nigerians carries one of the highest malaria burden in the world. And according to the WHO, that is World Health Organization data, Nigerians account for about 27% of global malaria cases and 31% of malaria deaths. It means malaria, which is the topic we want to consider today, it has killed a lot of people, maybe because they see it as a common sickness, and because of that, many will just looking at it that I don't have anything to work on, or maybe let me just take a common medication, and through this they don't know that this thing is killing a lot of people. I mean, a lot of them. On today's program, I have with me, oh, you will pardon me the way I will pronounce your word. You will pardon me. And I have here with me on the line Nurse Nwoko Ezinne, Maryconstance. Good evening, ma.
Thanks. Good evening. Good evening, Mr. Afolabi.
You are welcome to Earth Corner.
Thank you so much. Thank you.
All right. I want to believe that I tried with the way I pronounce your name.
You really tried. You really tried. You really tried.
All right. Thanks for that
Thank
accolade.
you.
Thanks for that accolade. You know,
You're welcome.
like I said earlier, that according to the World Health Organization data, Nigerians account for about 27% of global malaria cases, and the 31 of malaria deaths. With this, I want us to look at this issue of malaria. in the first place, okay, how can you define malaria? How can you describe malaria for our people to know that indeed this is what malaria means?
All right. Thank you so much once again, Mr. Falabi. I The little I can say about malaria is a description of how it really occurs. Malaria is a disease condition characterized by fever, chills, headache, nausea, vomiting, and what we call malaise. Malaise is a form of weakness that you see in somebody that has malaria. So that is what I can describe as the signs and symptoms of malaria. It's a kind of disease condition that is characterized by what I just mentioned right now.
Okay, what you are saying right now is that for someone to know that he or she is having malaria, this what I mean, all these things you've mentioned will show that okay, maybe like having an headache and vomiting. Is it all the headache that is being caused by malaria?
Not really, but those are the cardinal signs you will see. Headache, fever, and chills, headache sometimes, plus
Hello, are you there? Are you there? Oh, I think I've lost that call right now. I've lost that call right now. And okay. Uh oh, let me see. Hello, are you there? Hello?
má ṣe lògùn without doctor's prescription. Mo tẹnumọ́, call on doctor's attention if you need solution. Mo tẹnumọ́, too much is given, much is expected. Ìlera lọ́rọ̀, keep long and stay strong.
Hello, sorry for breaking transmission.
it's okay. It's okay.
All right, I'm listening to you.
Okay, like I said before, you may see one or two or three or even all of the symptoms in a patient that is having malaria. It's a sign that the person has malaria, but that does not definitely define that the person has malaria. The person has to still go and do a lab test to confirm that it is malaria. But these are some of the signs you will see in an individual that will tell you that the person is having malaria, especially the fever, chills, headache, nausea, vomiting, and malaise. Like I said before, malaise is a form of weakness. It's not malaria. We call it malaise in medical terms. It's a form of weakness, general body weakness. That's what it's called malaise. Thank you.
Okay, okay, all right. You during the course of your response, you talked about getting test. I mean, being tested before someone can ascertain that he is having malaria. Well, what about many people that even with these symptoms, they believe that okay, if they have these symptoms, it shows that they are having malaria without going for diagnosis or medical test.
It's a very wrong practice. It's a very wrong practice because there are other conditions that can mimic the signs and symptoms of malaria too. There are other conditions that can mimic the signs and symptoms of malaria. So the person has to do a blood test so that he will confirm that it is actually malaria and not just any other. Because like I said, like headache, if you have typhoid, you can still have headache. So headache can come in when you have malaria and also in typhoid. So you might be taking a medication for malaria, meanwhile what is wrong with you is typhoid. So doesn't make sense. So there's a need for malaria parasite test for you to confirm that it is malaria. Then before you can go ahead and get your medication by a doctor that will prescribe the medication for you, and you don't just go ahead and take any form of medication.
All right, okay. With this, what is the major causes of malaria? What is the major causes of malaria?
Malaria, like I said, like malaria is absolutely caused by mosquito bites. Absolutely caused by mosquito bites, especially the female Anopheles mosquito, which is infected. It contains a falciparum that causes malaria sickness. So, if it happens, if someone is bitten by this mosquito, that is the only time the person can get malaria. No, that's just it. It is caused by purely malaria bite, mosquito bites.
Okay, it is being caused by mosquito bite. You made mention, you said, do you have different mosquito, because you said especially by the female one?
Yes, we have what we call the hardest mosquito, the coolest mosquito, the female Anopheles mosquitoes, just to mention few. So it is the female Anopheles mosquito that carries the parasite that causes uh, malaria in endemic tropical regions. So
Okay.
other forms of mosquito can be found in some other places. They don't cause malaria. But the particular one that causes malaria is the female Anopheles mosquito, which carries the falciparum that causes malaria.
All right. As a layman like me, how will I identify a female mosquito that I will know, this is female mosquito? Can I identify it, or is it identifiable?
Well, you may not really identify it looking at the picture because, what the only thing is that it is mainly dominant in the tropical region. So anybody living in the tropical region, any form of mosquito that bites you is most likely to be the female Anopheles mosquito. So that is it. Except for those living in outside the tropical region, the people living in maybe America, Asia, and all the rest of them, other continents that have some other mosquito, that they are the ones that may be able to differentiate it from their own particular type of mosquito or kind of sandfly or bite that bites them. Because we also have down here, apart from the female Anopheles mosquito, we also have the tsetse fly, which also transmits another thing, but that would be a talk of another day. I don't want to digress. So the female Anopheles mosquitoes is very endemic in the tropical region. So most likely anybody that is being bitten by a mosquito is most likely to be the female Anopheles mosquito. So you don't need to go and you start using microscope to know if it is a female Anopheles mosquito that is biting you. So all you need to do is to prevent yourself from being bitten by any form of mosquito down here in the tropics, because most likely it's going to be the female Anopheles mosquito.
Okay. This malaria we are talking about, ma. For instance, now assuming I have someone close to me that he or she is having malaria, is it possible for me to contact that same malaria from such person? Is it contagious, the malaria that we are talking about?
Well, malaria is not contagious. It is not transmittable by sharing objects. It is purely through the bite of an infected female Anopheles mosquito. When it bites you, or maybe bites another person, it doesn't transfer it from another person to another person. It bites you because it's sucking your blood. In the course of sucking someone's blood, it gets the person infected with the parasite, the falciparum.
Okay. Okay. Now with this, I want to digress a little. There is a common saying that if the mosquito bites you, and some people believe that through that bite, someone can contact, apart from malaria, that someone can contact the HIV/AIDS. Is this notion, is it true?
It's a fallacy. It's not true. It's not true. No, nature made it in such a way. Do you know that the mosquito, there's what they have, what we call the proboscis that they are using to suck blood whenever they are trying to suck blood. And in the course of using that proboscis to suck blood, they have to puncture your skin, get to the blood before they suck it. And the HIV/AIDS parasite virus does not stay for seconds under the normal atmospheric pressure. So for a mosquito to bite you by sucking your blood and coming out, that by the time you come out to go to another person, even if you have HIV/AIDS, the virus must have died before it will get to you. So, and if it is true, by now almost all the populations in the whole world, in the whole tropical regions, must have been infected with HIV/AIDS. It's not true. That's not true. It's not a true
Okay,
It's not an, it's not
you
a,
mean this is just a fallacy?
yes, like I said before, yes.
Okay, thanks for your response on that. I believe that many of us we know that malaria only, I mean mosquito only transmit malaria, not HIV, and
Yes.
malaria is not contagious like other diseases. Now,
Yes.
let us look at this. This the carrier of the malaria, I mean the mosquito. My question
Hmm.
now is that what can make the mosquito come around and breed?
Well, a lot of things can make it. Things like dirty environments, mosquitoes breed in dirty environments, stagnant water. When you have a stagnant water that does not move, they breed very fast in a stagnant water that does not move. Then also bushes. If you have bushes around your houses, they also will attract the mosquitoes to come and breed. These and some other things are the things that can cause mosquitoes to come around and breed in someone's environment.
Okay. You mean somebody like me now who loves to be around the green plant that okay I want the green plant in my compound, and are you now saying that I'm trying to make mosquito even to live, I mean very close to me? Is that what you are saying?
You said green plants. Plants are different from bushes. When I say bushes, like all these rough bushes, thick bushes, bushy area, not plants. If you have plants, even if they breed mosquito, you can use repellents. But I don't think normal plants breed mosquito. What actually breed them is bushes, unkempt bushes that breeds mosquitoes.
Okay, okay, all right. Let's assume that I have a stagnant water, like you said, in my compound or very close to me. What can I do, or what such person can do to just make sure that there is no like reproduction of the mosquito? What can someone do?
Yes, you can fill up the water if it is a stagnant water that is in the ground. You can fill it. You can some fill the water. If it is a gutter that is stagnant, you can clean the gutter so that the water can be flowing. Because if they are flowing, it will carry the larva of the mosquito away. But if it is stagnant, it will allow it to breed, multiply, and also come out as mosquito. So you either clean your gutters so that the waters can be flowing. Then if it is the water that is on the road, that you know there's no way you can channel it to go inside the gutter, you can some fill the water so that it will not be stagnant and breed mosquitoes.
Okay, all right. Oh, thank you for that solution. Um, Looking at the malaria, can it be treated?
100%, it can be treated. It can be treated very well. After your test, after you must have run your test, seen a doctor who conducted a malaria parasite test, then you have to take what we call the artemisinin-based derivative anti-malaria drugs. What we call them artemisinin-based because these days there's a lot of resistance because of what has been happening over the years of taking anti-malaria and all the rest. So it has been accepted and noted by World Health Organization that artemisinin-based derivatives are the best for for malaria treatment.
Hmm. Okay. All right. Now, I want to ask this question. You know, we have some people who are who believes that okay, uh, for them, I mean, with them having malaria, they will believe that okay, they will not treat that malaria. Is there any adverse effect if someone fail not to treat the malaria in their bloodstream or in their body system? Is there any adverse effect?
Yes, very deadly adverse effect there is. In fact, that's what we call cerebral malaria. When you don't take anti-malaria, when you don't treat malaria when you have malaria, it gets to accumulate in such a way that it crosses the blood, what we call the blood-brain barrier, and affects the brain. When it affects the brain, the person will start presenting signs and symptoms of madness, sometimes symptoms of psychosis. We call it madness, psychosis, but the layman's word is madness. So, and which is what somebody that will not want to experience. So it's better if you have all those symptoms we mentioned earlier on, fever, chills, headache, and malaria, and all the rest of them, you better run and go and run a test. confirm if it is malaria, treat it so that it doesn't enter your brain and cause mental illness. Signs and symptoms of mental illness.
If I understand you clearly, you know what psychosis means is for someone to have a delusion, hallucination, and the likes. Are you now saying that
Yes,
even for someone not to treat malaria as it is expected can lead to psychosis?
yes, definitely, 100%. If it enters the brain, the blood-brain barrier, if it crosses the blood-brain barrier, it will cause the brain to malfunction, therefore presenting the signs and symptoms of a psychiatric problem, psychosis.
Hmm. Hmm.
Mm.
Okay. This malaria we are talking about, can it be preventable? Can malaria
Yes,
be
very.
preventable?
Yes, it can. Very well. It can be
Okay. How
preventable.
can someone
I
prevent
know.
it?
Simple, just by following the instruction we once mentioned. First of all, you make sure your environment is clean. Make sure you don't have a stagnant water around that breeds mosquito. Then, most importantly, sleep under mosquito nets, especially the pregnant mothers and children, because they are the vulnerable groups. Then, pregnant mothers should make sure they sleep under mosquito net to prevent mosquito, because malaria in pregnancy is a very serious condition. It's not something you want to handle when you are pregnant. It's a very serious condition. It can affect the mother and the baby as well. So those things I mentioned, sleeping under mosquito nets, making sure your environment is free from stagnant water, and clearing bushes around you can help prevent malaria. Because by so doing, you are preventing the causative organism, which is the mosquito, from biting you.
Okay, I think I need more clarification, because during your response, while you are responding to the question, you talked about that malaria is not contagious, that someone cannot contact malaria. But now you are saying that the pregnant women should be cautioned. Are you now saying that even if the mother have the malaria, it will affect the baby in the womb?
Yes, because the baby is still living inside the womb. So whatever that is circulating in the blood is circulating both for the mother and for the baby. What I mean by not being contagious is by when you say something is contagious, it means I can get it by either eating with you, sharing objects with you, and all the rest of them. So it is not contagious by because individuals that are already grown up, mature people that are not another somebody that is not pregnant cannot transfer it to her baby. But a pregnant woman can transfer it to her baby because it is the same blood running in the blood of the pregnant woman that is circulating for the baby. So, but for adults, individuals, family members, or even mothers, or even a child that is already been born, it cannot be transferred to that child. But once the baby is still in utero, that is inside the womb, the baby can get the malaria. It can affect the baby because the blood circulating the malaria parasite is within the mother's blood.
Hmm. Okay. Now you as a professional nurse, what are your advice for people about uh, the topic of today, which is treatment of the malaria? What are your advice?
All right. My general advice for the general public is this. Once anybody comes down with any of the symptoms, they should quickly run to any medical outlet around them, be it wherever they are. I know these days they have health centers, they have tertiary institutions, they have so many places where you can access health care. And also with good things now happening, people have insurance companies that are also helping to curb the excesses of health cost of health care. So they can access any health care to go and run the test and confirm if it is malaria. And once they confirm it is malaria, they should be treated so that they will prevent having cerebral malaria, which can cause what is known as psychosis or present the symptoms, signs and symptoms of psychosis. Then they should also make sure their environment is free of anything that can breed mosquito, which is stagnant water, bushes, and dirt. Then above all, pregnant mothers should make sure they sleep under mosquito nets. Not just pregnant mothers as well. I think everybody should sleep under mosquito net because malaria you can't stop mosquito entirely. But when you sleep under mosquito, you are 100% sure you are not going to come in contact with mosquito. Or better still, there are some repellents which are also good, but so though some of them can affect one's health, especially the asthmatic ones. So if someone is asthmatic, they can go under the mosquito net, make sure the environment is neat, and make sure there's no stagnant water around them, as well as bushes. By so doing, they will ward off mosquito around them, have a peaceful night's rest without mosquito bites. By so doing, preventing malaria at large.
Okay. Lastly, before I will let you go for today, this is my question, which I want you to enlighten us. Is that if I discover that I have malaria, is there any first aid for me before going for test, as your final advice or as a final word for today?
Well, I'm going to answer your question on two stages by giving you two scenarios. If it is an adult, if it is an adult that came down with something like headache, fever, so the person cannot quickly take paracetamol as a form of first aid to get before he gets to the hospital. Then if it is for a child, it's also applicable, because if you leave the fever to continue in the child, it will lead to what we call convulsion, which is not good. So that is why it is advisable for mothers to have what we call paracetamol tablet, or suppository for children, tablets for adults, suppository for children, or even syrup for smaller children, so that whenever they are coming down with fever, especially if it is at night, or when it is not convenient for them to access the health care, they can just take the paracetamol, then rush to the nearest hospital. They should not use the paracetamol to be subduing the headache and the fever, and be waiting for them, thinking that it will take care of it. It is just a form of, kind of, like you said, a first aid before you can get to the hospital. But it's not a treatment to malaria.
Okay. Thank you for your advice. I really appreciate you, and I want to say this to all our viewers, that whatever we've learned from today's topic, it is advisable for us to utilize it, so that we will not lead ourselves to places where we don't want to be. Like she said, that a long malaria in our bloodstream can cause psychosis, and we know what psychosis means. No one pray to have that sickness, because
No, nobody
it is not something palatable. And
at all.
to avoid all this, we should kept to the advice she gave to us, that we should stay in a clean environment, and when we discover that we have a malaria, we should contact the medical practitioner,
Healthcare
who will help us to discover or diagnose if truly what we have is malaria
malaria.
or not. Thank you so much, Nurse Nwoko, Ezinne, Maryconstance. It's my pleasure to have you on the program.
My pleasure too. Thank you so much.
All right. Tomorrow is another day, and I'm urging all our viewers that join us tomorrow exactly 5 p.m. Nigerian time, where we'll be having a conversation about our health on your favorite program, Health Corner, with Nurse Nwoko, Ezinne, Maryconstance. Tomorrow it's another day. On behalf of the Chief Executive Officer, who happens to be the chief producer of this program, Deacon Michael Adeboye Ashaolu, I'm saying to Nurse Nwoko that thank you for your time. Really appreciate you.
Thank you so much, Mr. Afolabi. I am very grateful to educate the public.
All right. Till tomorrow, from my hand, I'm saying bye to you and to all our viewers. We are saying bye for now. And many thanks
Bye for
to
now.
the man behind the console, which is Balogun Absamadi, is the one helping us just for you to see our picture clear and our sound. And to all the esteemed crew, we say thank you for your support. Thank you for your contribution. Tomorrow it's another day. Let us have it and do it once again. I still remain my humble self, Adenipekun Afolabi. And many thanks to the sponsor of this program, that is Eni Akmole Foundation, funded by Deacon Michael Adeboye Ashalu. On this note, I'm saying bye for now. Tomorrow it's another day. Join us tomorrow for another edition of your program at Corner.
trendybeats.com